Ginger, a common ingredient found in many kitchens and an integral part of several cuisines worldwide, is known to thin the blood, a biological process that can have a profound impact on our health. This humble root, revered for its medicinal and culinary properties, interacts with our bodily functions in a way that can be both beneficial and potentially harmful. In the context of blood thinning, ginger's bioactive compounds, such as gingerols and shogals, tend to inhibit the clotting of blood. This property is beneficial for most, as it promotes a healthy cardiovascular system by preventing the formation of blood clots that could lead to serious conditions such as strokes or heart attacks. However, it's a double-edged sword. For certain individuals, this same property of ginger could prove to be a complication rather than a boon, particularly those who already have conditions like hemophilia, where their blood's natural ability to clot is compromised, can experience adverse effects. Hemophilia is a rare disorder where the blood lacks sufficient blood clotting proteins, thereby making the individual more prone to excessive bleeding, even from minor injuries. In such cases, consuming ginger could exacerbate their condition by further inhibiting the blood clotting process. In addition to this, there are also those who are on blood-thinning medications. These are usually individuals with a high risk of developing blood clots, and their medication is designed to prevent clot formation. When people on such medication consume ginger, it can result in their blood becoming too thin, a state that could potentially lead to internal bleeding or other serious complications. In light of these factors, it becomes critical for certain individuals to exercise caution when it comes to ginger. It's advisable for these individuals, specifically those with conditions such as hemophilia or those who are taking blood-thinning medications, to steer clear of ginger. This is a testament to the fact that while natural remedies and ingredients can offer numerous health benefits, they must still be consumed mindfully, taking individual health conditions and needs into account. Ginger, an aromatic spice revered for its vibrant flavor and potent health benefits, has been showcased in numerous studies to possess the ability to regulate one's blood sugar levels. This magnificent root, which has been an integral part of traditional medicine for centuries, can play a significant role in the management of glucose levels in the bloodstream. Enticingly fragrant and imbued with a unique warmth, ginger's potential extends far beyond the culinary realm. It's not just a spice that enhances the taste of our meals, but also a potent functional food that is rich in powerful bioactive compounds. One such compound is gingerol, the main bioactive compound found in ginger, which is known for its potent antioxidant and anti-inflammatory effects. In the context of diabetes, ginger's capabilities should be noted and respected. The research indicates that ginger may help reduce fasting blood sugar levels and improve HbA1c, a marker for long-term blood sugar control. But, and this is crucial, it is not a standalone treatment. It should not be used as a substitute for prescribed diabetes medications, but rather considered as a potential adjunct therapy. However, in the complex and delicate balance of managing diabetes, ginger also has the potential to interact with diabetic medications. Its interaction could disrupt the careful equilibrium that must be maintained when treating this condition. Therefore, if you have diabetes, it's best to consult with a healthcare provider before adding ginger to your diet. Making informed decisions about your health is always of paramount importance. Ginger, a common root used worldwide for its piquant flavor, has a lesser-known side effect. Its ability to stimulate bile production can make things worse for certain individuals. One might ask, how does ginger stimulate bile production? To understand this better, let us delve into the human body's digestive system. When we eat, the food reaches our stomach where the digestion process begins. At this point, our liver secretes bile, a digestive fluid that helps in breaking down the food, especially fats. Now, ginger's role comes into play. Ginger, when consumed, prompts the liver to produce more bile, thus aiding in digestion. However, this might not be a good thing for everyone. For those individuals diagnosed with gallstones, an increase in bile production can be harmful. Gallstones are hard deposits in the gallbladder, a small organ under the liver that stores bile. If more bile is produced and the gallbladder is already dealing with these deposits, it can inflame the gallbladder, leading to a painful condition known as gallbladder disease. So, ginger, while beneficial for a majority of us, can be a health concern for certain individuals. These individuals are primarily those who have had prior issues with their gallbladders. They should be cautious about their ginger consumption. Those with a history of gallbladder issues should think twice before consuming ginger. Ginger, a culinary marvel that has been a staple in cooking and traditional medicine for centuries, has a particular characteristic that may not be beneficial for everyone. This remarkable root's propensity to lower blood pressure and heart rate, a feature often celebrated for its potential health benefits, may not be suitable for those with heart conditions. Let's delve a little deeper into why this is so. Ginger is a powerful herb known for its anti-inflammatory and antioxidative effects. It's popular in natural medicine and is used to treat a wide swath of ailments from nausea to muscle pain. But one of its most notable properties is its ability to influence our body's circulatory system. Specifically, ginger can cause a drop in both blood pressure and heart rate. This effect is usually a positive one. High blood pressure or hypertension is a common problem in our modern world. It can lead to heart disease, kidney problems, and stroke if left unchecked. A natural treatment like ginger, that can help to lower blood pressure, is often welcomed by those looking for non-pharmaceutical interventions. However, for some, this property of ginger can potentially be problematic. Those with heart conditions, particularly those who already have low blood pressure or a slower heart rate, may need to exercise caution with ginger. In these cases, the lowering effect of ginger might exacerbate their existing conditions, causing further complications. So, what should people with heart conditions do? The answer is simple. Those with heart problems would do well to talk to a healthcare provider before using ginger. Only a medical professional can fully evaluate individual health circumstances and provide personalized advice. This is a safety measure that should be taken by all, not just by those with heart conditions, when considering adding new elements to their health routines. While often used to alleviate nausea, ginger holds a prominent place in many home remedy arsenals. It's a root with an array of health benefits, from boosting the immune system to aiding digestion. It's a common ingredient in many dishes around the world, and people turn to it in times of mild discomfort. Its versatility is astounding. Not only is ginger utilized in cooking, but it's also ground down into a powder for medicinal purposes, steeped in hot water for a warming cup of tea, or even pickled to serve as a zesty accompaniment to sushi. But it's not just the versatility of this root that's astounding. It's also its potency in enhancing health and well-being. However, it's crucial to note that there is such a thing as too much of a good thing, and ginger is no exception. Consumed in high quantities, it can have adverse effects on specific individuals. Crucially, pregnant women are one such group that needs to exercise caution with ginger. Pregnancy brings about a whole new set of rules when it comes to nutrition and diet, and ginger, despite its many benefits, can pose potential risks when consumed in high doses. It's believed that excessive amounts might increase the risk of miscarriage. This is why it's always essential for pregnant women to seek professional medical advice before including certain foods in their diet, particularly those known to stir controversy. Pregnant women should always consult with an obstetrician before using ginger. Ginger's ability to suppress appetite and aid in weight loss might not be ideal for those who are already underweight or struggling with eating disorders. If this is you, be sure to monitor your ginger intake. For some, ginger can aggravate symptoms of acid reflux. If you have GERD or experience frequent heartburn, it's advisable to limit ginger consumption or consult with a gastroenterologist. Ginger's natural blood pressure lowering effects might interact with your medication, potentially leading to excessively low blood pressure. Always talk to your doctor before incorporating ginger into your routine. Due to its blood-thinning properties, ginger should be limited before surgery as it can increase the risk of bleeding during and after the procedure. Make sure to follow your surgeon's guidelines regarding ginger intake prior to surgery. So there you have it, 9 health conditions that may not gel well with ginger. While it's true that ginger can be incredibly beneficial for many people, it's not suitable for everyone. Always consult with your healthcare provider before making any significant changes to your diet or lifestyle. Until next time, stay healthy and informed.